RESCUE-ALS is a phase 2 placebo-controlled trial of one dose of CNM-Au8, 30 milligrams, versus placebo in patients with early ALS. So you have to have ALS within 1 year of onset. We're using a biomarker here as a primary endpoint. It's called something called the motor unit estimation, which is based on an electromyography technique called motor unit index, or MUNIX. And the way MUNIX works is we pick certain muscles. We pick two muscles in the hand, the abductor pollicis brevis and the abductor digiti minimi. And then we also choose the biceps brachii in the arm and the anterior tibialis in the leg. And what we do is we stimulate those muscles directly by stimulating the motor nerve to the muscle. And we generate what's called a maximum compound muscle action potential that muscle can generate based on a surface electrode that's recording. Then we stop, and then we ask the patient to isometrically contract that same muscle as hard as they can. We can generate the maximum compound muscle action potential that the patient can generate. Then those were both recorded. And then a computer algorithm looks at the interference pattern between those two ways of activating the muscle and can estimate the number of attacked lower motor neurons serving that muscle. And we know that dropout of motor neurons is progression in ALS, and dropout of motor unit index and the motor unit estimate based on MUNIX does predict disease progression in ALS based on a couple of different studies that have been done. Now, this has never been used as a primary endpoint in a phase 2 study before, but it was used as an exploratory endpoint in the dexpramipexole program from Biogen. And what they showed was a linear decline in motor unit estimate based on MUNIX, which was exactly the same for both placebo and active. So what's the expected is a linear decline in motor unit index over time, and that's even on standard of care, even on Riluzole. So in Australia, the study is being run at 2 EMG centers, neuromuscular centers in Sydney, Australia. And Australia, the standard of care is Riluzole because Edaravone is not approved in Australia. So everybody's on Riluzole, and we're using CNM-Au8, 30 milligrams versus placebo. And what we presented most recently at the Motor Neuron Disease Association meetings in December was that actually through week 12, we were seeing it for about half the patients. Again, the study's still blinded, so we don't know who's on placebo. It's a 1-to-1 randomization. What we showed was through 12 weeks, at least half the patients were having an increase in motor unit index. That is an increase in the estimated number of attacked lower motor neurons serving these muscles. And then by week 24, there was a stabilization in that group in about half the patients. And the other half of the patients are having a linear decline, as expected on Riluzole. So we don't know who's who. Of course, we know that placebo works in neuroscience. You have to be very, very careful. But again, we're very encouraged by the blinded data that we're generating in the RESCUE-ALS study. Now, this study will be fully unblinded. We'll have the primary data readout by September of 2021. So the study is close to being finished.